Hi, I'm Dr. Matthew Wheaton, owner and veterinarian at Alicia Pet Care Center, and today we are talking about and looking at a surgery that I recently did for Stenotic Nares on a little French Bulldog. Okay, we are viewing our patient here with very small nasal openings, and I am right now kind of talking with my team and explaining what I'm about to do. Basically, this is take a chunk out of the tissue and sew it back up, and when you sew it back up, it's going to create an opening. So I'm demonstrating where I'm about to cut. Basically make an incision and create a triangular gap in that tissue, going basically straight down, as you'll see me put my scalpel in, going straight down through that piece of tissue, and then creating another triangle off to the side, or another side of the triangle, and removing a triangular piece of tissue that then creates a gap, and that gap must be closed, so it is sutured closed. And when you close the gap and you just removed a chunk of tissue, it's going to make the whole area smaller. Well, in this case, it's going to make the hole bigger. So it's very, it's a very bloody kind of procedure because you're cutting through tissue and you are not cauterizing it as you go. And you'll notice once I start putting sutures in, that bleeding will stop very quickly. But I'm already working on the second cut there, so I've made both of my incisions and I'm going to remove that chunk of tissue. And my scissors now are removing a tiny bit of attachment of that tissue. And there's the chunk of tissue that we removed. Going on to the other side now. And you can see potentially a little bit better now. It's very bloody. It's a hard one to do at first when you're learning how to do this for folks that are watching this, because the bleeding is distracting, but you just power through, because once you get that piece of tissue out of there and you are able to actually make your first suture placement, the bleeding just stops because you're just opposing those two sections of tissue. This dog had a really nice end result to the corrective surgery that is part of what the French Bulldogs need to facilitate their resolution of their upper airway issues. And here you can see me putting the sutures in to close that gap, and it's a really nice opening of that nasal passage, and now it looks more normal. We don't have a slammed shut opening that doesn't allow for airflow when the dog is breathing through its nose. So this is a procedure that a lot of French Bulldogs need. Other dogs that are affected with this are a lot of the snub-nosed brachycephalic dogs, pugs, Boston Terriers, Bulldogs. I'm doing a Boston Terrier next week that is getting neutered, and I will fix its nose issues at the time of the neuter. A pretty simple procedure once you've done a few of these. It's not too scary. Just taking care to make sure that you have a good cosmetic appearance at the end of it, with as close as you can to symmetry between one side and the other. So trimming away some additional tissue in there, and look at that end result. We have a nice open nasal passage, and this dog will recover nicely. The bleeding will not continue to keep going on, and we really don't have pronounced risks of post-operative problems. It's a very different situation when we're talking about the bigger issues that these dogs have, which is soft palate resection, for elongated soft palate, everted laryngeal saccules, and large tonsils. All of those things are back in the back of the throat, and you need to make sure that you're doing that procedure with expertise and experience and very close monitoring after the procedure, because the recovery period is when problems arise, and we do have risks associated with that that procedure, there's a small percentage of dogs that will have post-operative complications, and that can be very serious. So really important that you're using somebody that's done this multiple times, and also a facility that can maintain really close watch on them while they are recovering to ensure that they have a good experience. Fairly exciting to watch the end result of this, which is instant gratification, because we take a dog who's very abnormal and make them very normal with this aspect of their body conformation. This is a cute little dog. Very good dog. Very acceptable end result with increased size of those nasal openings. Hooray! Thanks everybody for watching, and be sure to stop by for more, because we'll do these again, and tell us your thoughts in the comments. Look how nicely the dog is holding still. Just kidding. There's a full anesthesia going on here, obviously, with the tube in the throat.